So one of my favorite procedures to do is a drain-free tummy tuck, especially on a patient like this who's a massive weight loss patient. We're seeing a lot of folks now who are losing significant amounts of weight with the semaglutide type drugs. So we have your Mounjaro, Ozempic, Wegovy. This patient using those medications managed to lose 80 pounds. Typically, if you're losing a lot of weight, you want to make sure your weight is stable for quite a bit of time before embarking on surgeries to get rid of loose skin. You don't want to be actively losing weight while you are undergoing the surgery, because you're going to have a lot to heal. But in this result, I just want to talk about some of the advances we've made over the past few years when it comes to tummy tucks to get really nice results. So first of all, this surgery, as all my surgeries are done, was done with a drain-free technique. We're not just skipping the drains, we're doing what are called progressive tension sutures in there to close down the dead space and get rid of the need for drains. I do this more kind of famously in top surgeries, but I use the same progressive tension technique in all of my patients, and therefore we're able to skip the need for drains. So that's number one, we're never going to do that. Number two is, with the old school tummy tucks, we used to try and get everything as flat as possible. So it would just be like your result would be like a flat sort of board, and then your belly button in the center of it, which wouldn't oftentimes look very natural. We'd be just pulling that skin as tight as we can, but with modern tummy tuck techniques are really trying to respect that underlying anatomy to help the patient look, one, more athletic, and two, more natural. So you can see in this patient, we're able to outline her six-pack anatomy. She has that lovely line going down at the center. It's called the linea alba. And then the other two lines you can see outlining her pecs, and she's done a lot of work, or no, sorry, not her pecs, her abs. She's done a lot of work on these abs. We tightened them up while we were in there at the same time. But we're able to see contours now on the abdomen, so it really gives a more natural muscular sculpted look rather than the old school technique, which was just like really tightly pulled and belly button sticking in the middle of it. The next thing is, of course, the belly button. So belly button, a lot of patients shy away from tummy tucks because they're concerned about the scar around the belly button because it can be a tell. And so typically when we're doing these surgeries, we want to put the scar down really low so it's hidden in the pants. And then with the tummy tuck, we want to get it in there as deep as possible. So in this picture, you can't really see where the incision is around the belly button because it's hidden in low, and we have that depth and again nice contours to that belly button as well. This surgery typically takes me about 2.5 to 3 hours. The patient is completely asleep. They're able to go home the same day. We can, it depends on the patient's wants and needs, we can combine in other surgeries with it. Most of my patients take 2 to 3 weeks off after this procedure and about 6 to 8 weeks off heavy lifting and working out. But it's really one of the most gratifying things we can do. There's a myth out there that like toning and working out can shrink some of the skin, the loose skin after weight loss. There may be some truth to that, but really I believe the only thing that truly gets rid of loose skin is going to be an incision. You got to do it. You got to get rid of, just cut it out basically. Morpheus, all those other things, you know, they can give you a slight improvement, but at the end of the day, if you have loose skin like this, it's a tummy tuck, it's what you're going to need.